In the next few minutes, you will learn more about the care and cleaning of the KaVo ESTETICA E70 Vision and ESTETICA E80 Vision dental units. You have the option of watching the complete hygiene video, or directly selecting specific sections such as in the morning, after treatment, in the evening, weekly, maintenance, or as required. Under the As Required category, you will find instructions for replacing DEKASEPTOL gel and OXYGENAL 6. Information on the amalgam separator and manual internal cleaning of the suction hoses. Your ESTETICA E70 E80 Vision dental unit is designed to make hygiene procedures as comfortable and efficient as possible. For this purpose, it is equipped with an intuitive hygiene guide on the dentist element, the DEKAMAT and OXYMAT for placing and automatically dosing the two cleaning agents, and an integrated hygiene center. The hygiene center is located in the middle section of the unit body, concealed beneath the spittoon bowl. To open it, move the chair to the cleaning position. You can find it in the Hygiene tab. Alternatively, you can also push the spittoon bowl away by hand. You can easily remove the lid of the Hygiene Center by tapping it on one side. Here you can see the adapters for couplings and motors, and the adapter for the E-scaler. In the center are the adapters for the syringes, the black adapter for the multifunction handpiece, and the gray one for the three-function handpiece. On the assistant side, you'll find the connection points for the suction hoses. You will receive hygiene alerts on the dentist element as soon as, for example, one of the cleaning agents needs to be replaced or the weekly cleaning program should be carried out. The C-curve can optionally be configured with ambient lighting to display the status of the automatic hygiene programs. As soon as an automatic hygiene program starts, the light switches off. If the hygiene program requires manual intervention, such as returning the hoses, the light begins to pulse. Once the hygiene program is complete, it lights up constantly, indicating that the unit is ready for use. Please ensure you wear personal protective equipment when cleaning and maintaining your medical devices. Switch on your dental unit at the start of each working day. If the evening hygiene program was selected the previous evening, the morning hygiene program starts automatically after switching on the dental unit, provided the instrument hoses have remained in the hygiene center overnight. Alternatively, you can select the program in the morning in the Hygiene tab and follow the hygiene guide instructions. Connect the instrument and suction hoses to the respective adapters in the hygiene center as described in the hygiene guide. Please check that the spray function is open on all instrument hoses. A tip: place a cup on the cup holder to avoid splashing water. Now each instrument and suction hose, as well as the cup filler, is automatically flushed for 2 minutes each according to the Robert Koch Institute guidelines. During the program sequence, the optional light in the C-curve switches off, indicating that a hygiene process is running. After the hygiene program has finished, you can remove all instrument and suction hoses from the hygiene center and place them back in their positions, as shown on the touch display. The end of the completed program is additionally indicated by the optional light in the C-curve beginning to pulse. This way you can immediately see that manual action is required. This function is available for all automatic hygiene programs. Then close the hygiene center. Now prepare your dental unit for the next treatment. After you have completed your treatment, disinfect the instrument tubes and instruments. Then remove the instruments as well as the sleeves of the triple function or multifunction handpiece for hygienic reprocessing. Please observe the instructions in the operating manual for the respective instrument. For cleaning and disinfecting surfaces as well as instrument and suction tubes, please only use disinfectants approved by KaVo. These disinfectants have been tested for their material compatibility with KaVo dental units. The use of other disinfectants can lead to discoloration and material damage. Please also check whether your gloves are resistant to disinfectants, as they can otherwise also lead to discoloration. Now go to the Hygiene tab and move the chair to the cleaning position. Lock the user interfaces using the corresponding button in the Hygiene tab on the dentist element of your KaVo ESTETICA E70 Vision and ESTETICA E80 Vision. Alternatively, the user interfaces can also be locked using the KaVo button on the assistant element. Now you can clean the surfaces. Then clean the assistant element, including the suction tubes and the arm system. To unlock the user interfaces, please press the foot pedal for 2 seconds. Now start the hygiene program after treatment and follow the displayed instructions. Open the cover of the hygiene center and insert the externally wiped disinfected instrument and suction tubes, as well as the syringe bodies into the corresponding adapters. Please check that the spray function is open on all instrument tubes. A tip: place a cup on the cup holder to avoid splashing water. Press continue. All instrument tubes and syringe bodies are now automatically flushed for 20 seconds in accordance with the guidelines of the Robert Koch Institute. The drainage and separation system is flushed hydromechanically with water in parallel. During the automatic run of the cleaning program, you can wipe disinfect the monitor and the operating light, including the arm system. At the end of the hygiene program, remove the instrument and suction tubes from the hygiene center, return them to their positions, and close the hygiene center. Wipe disinfect the upholstery and, if present, the armrests of the patient chair, the patient part and the spittoon bowl, the unit body and the operator stools. Don't forget to clean the operating levers of the operator stools. Now prepare your dental unit for the next treatment. After you have completed your treatment, wipe disinfect the instrument tubes and instruments, and then remove the instruments and the sleeves of the triple function or multifunction handpiece for hygienic reprocessing. Please observe the instructions in the operating manual for the respective instrument. For cleaning and disinfecting surfaces as well as instrument and suction tubes, please only use disinfectants approved by KaVo. These disinfectants have been tested for their material compatibility with KaVo dental units. The use of other disinfectants can lead to discoloration and material damage. Please also check whether your gloves are resistant to disinfectants, as they can otherwise also lead to discoloration. Now go to the Hygiene tab and move the chair to the cleaning position. Lock the user interfaces using the corresponding button in the Hygiene tab on the dentist element of your KaVo ESTETICA E70 Vision or ESTETICA E80 Vision. Alternatively, the user interfaces can also be locked using the KaVo button on the assistant element. Now you can clean the surfaces. Then clean the assistant element, including the suction hoses and the arm system. To unlock the user interfaces, please press the foot pedal for 2 seconds. Now start the evening hygiene program and follow the displayed instructions. Open the hygiene center cover and insert the externally wiped disinfected instrument and suction hoses, as well as the syringe bodies, into the corresponding adapters. Please check that the spray function is open on all instrument hoses. A tip: place a cup on the cup holder to avoid splashing water. Press continue. All instrument hoses and syringe bodies are now automatically flushed for 20 seconds in accordance with the Robert Koch Institute guidelines. The drainage and separation system is simultaneously flushed hydromechanically with water. During the automatic cleaning cycle, you can wipe disinfect the monitor, the operating light and the arm system, as well as the patient chair, the armrests, the arm system of the dentist element, and then the patient part, including the spittoon bowl and unit body. After the evening hygiene program has finished, you can leave the instrument and suction hoses as well as the syringes in the hygiene center and switch off the dental unit. The DEKASEPTOL gel can now act in the suction hoses overnight. On the next treatment day, the morning hygiene program is started after switching on the dental unit. During the morning program, the instrument and suction hoses are automatically flushed. The weekly cleaning program prevents the formation of microorganisms during longer periods of inactivity. During the weekly cleaning program, the suction hoses are automatically cleaned and disinfected with DEKASEPTOL gel, and the supply water pathways are enriched with an increased concentration of KaVo OXYGENAL 6. The weekly cleaning program takes approximately 45 minutes. The increased hydrogen peroxide concentration acts in the system for at least 30 minutes or 48 hours over the weekend. After you have completed your treatment, disinfect the instrument hoses and instruments, and then remove these and the sleeves of the triple function or multifunction handpiece for hygienic reprocessing. Please observe the instructions in the operating manual for the respective instrument. For cleaning and disinfecting surfaces as well as instrument and suction hoses, please only use disinfectants approved by KaVo. These disinfectants have been tested for their material compatibility with KaVo dental units. The use of other disinfectants can lead to discoloration and material damage. Please also check whether your gloves are resistant to disinfectants, as they can otherwise also cause discoloration. Now go to the Hygiene tab and move the chair to the cleaning position. Lock the user interfaces using the corresponding button in the Hygiene tab on the dentist element of your KaVo ESTETICA E70 Vision and ESTETICA E80 Vision. Alternatively, the user interfaces can also be locked using the KaVo button on the assistant element. Now you can clean the surfaces. Then clean the assistant element, including the suction hoses and the arm system. To unlock the user interfaces, please press the foot pedal for 2 seconds. Now start the weekly hygiene program and follow the displayed instructions. Open the hygiene center cover and insert the externally wiped disinfected instrument and suction hoses, as well as the syringe bodies into the corresponding adapters. Please check that the spray function is open on all instrument hoses. A tip: place a cup on the cup holder to avoid splashing water. Then press Continue. All instrument hoses and the syringe bodies are now automatically rinsed in accordance with the guidelines of the Robert Koch Institute. The supply waterways are automatically enriched with an increased concentration of KaVo OXYGENAL, whilst the suction hoses are rinsed and disinfected. You can continue to disinfect the dental unit during the automatic run of the maintenance program. When the exposure phase begins, a message appears on the dentist element display and a signal sounds. Leave the hoses in the hygiene center during the exposure phase. If you have started the program before periods of stagnation such as the weekend, you can now switch off the dental unit. Otherwise, wait for the exposure phase to complete. After completing the weekly cleaning program, you can place the hoses back in their positions. We recommend removing and cleaning the silicone mats and handles of the dentist element, the instrument holder on the dentist element, the cup filler, and the spittoon bowl weekly. The spittoon bowl made of porcelain and smoked glass can be reprocessed in the thermal disinfector. The silicone mats and pad of the swing table, as well as the optionally available grey handles, can be sterilized in an autoclave. We recommend checking the turbine's return air filter weekly. To do this, follow these steps. Remove the cover under the dentist element. Remove the filter and check for liquid. If necessary, replace the filter and clean the filter housing. If there is liquid in the filter, also check and replace the O-rings on the multi-flex coupling. The instrument tray can be removed for cleaning. Press the 2 retaining lugs on the left and right outwards and remove the tray. Clean it under running water. Then dry and reinsert it from below under the dentist element, press on and snap into place. In the evening and as required, the sieve of the spittoon bowl must be cleaned. We recommend removing the bowl at regular intervals and cleaning it at the sink. The porcelain spittoon bowl can be reprocessed in the thermal disinfector. The sieve inserts must be checked daily and after surgical procedures. The sieve inserts must be replaced at the latest when the suction power decreases. Press the handle and then carefully pull out the sieve insert to check it and replace it if necessary. Cleaning is not recommended for hygienic reasons. Afterwards, wipe disinfect the suction hoses. A tube of silicone grease is supplied with each dental unit. It is used to lubricate the O-rings. It is best to rub a pea-sized amount onto the thumb and forefinger before the weekly intensive germ reduction. Then lubricate the O-rings of the motors, the syringe handpieces, the multi-flex coupling and the cup filler. The instrument holder of the hygiene center can be removed, cleaned and thermo-disinfected. As soon as DEKASEPTOL gel or OXYGENAL 6 is empty, a message appears in the hygiene area of the dentist element. Remove the cover on the unit body. Remove the DEKASEPTOL gel bottle, screw the connection onto a new bottle and insert it into the DEKAMAT. After the message appears for missing OXYGENAL 6, replace the OXYGENAL bottle. Then you can close the cover. If the container of the amalgam separator needs to be changed, a message is displayed on the touch display of the dentist element. Remove the cover on the side of the assistant element. Now unscrew the full container from the socket and dispose of it in accordance with regulations. Next, take the new container out of the packaging and screw it into the socket. Close the cover. For various treatments, it is recommended to perform a manual internal cleaning of the suction hoses during the procedure. To do this, remove the cannula from the suction hose connector and hold it against the designated flushing point. The suction hose is now flushed. An acoustic signal sounds when finished. After flushing is complete, remove the suction hose from the flushing point and place the cannula or saliva ejector back onto the designated suction hose connector. Care instructions, a care and cleaning schedule, and brief operating instructions are supplied with the dental unit. The complete operating instructions for the KaVo ESTETICA E70 Vision and ESTETICA E80 Vision and all other documents are also available for download on the KaVo website. There you will find all the content for reference. That was the instruction guide for the care and cleaning of the KaVo ESTETICA E70 Vision and ESTETICA E80 Vision. We wish you a lot of fun with your KaVo masterpiece.